All right, so hi everyone. For anyone that doesn't know me, my name is Ann Udofia. This is week 4 of a 4-week series of pelvic health tips to help with postpartum recovery. Today we're talking all about painful sex. And I will go ahead and, well, if this is your first time on one of these webinars, really quick, you can see and hear me. I cannot see or hear you. So if you have any questions that come up for you, please just go ahead and just type it into the chat. And when we get to the end of the session, there'll be more than enough time for some Q&A, okay? So I'm going to go ahead and share my screen here. Okay, move this. And present. And move my face. All right, so if this is your first time joining this series, welcome, welcome. My name is Ann Udofia. I'm a pelvic floor physical therapist here at Agile Physical Therapy, and I specialize in prenatal and postpartum health. Okay, and again, this is the first time you're joining. I'm not gonna go too much into my family, but I'll say too much about my family, but this is my family. I have a 6-year-old son. His name is Joshua, and I have a 4-year-old daughter. Her name is Hanyeli. All right. Now, the agenda for today. This is short and sweet of a 30-minute class. I will be talking about the goals for the class today. I'll go ahead and give the presentation. We'll have enough time for some Q&A. And like I said, if questions are coming up for you, feel free to just type it into the chat. I do get quick alerts that a message has come through, but I'll probably save to a good amount of time at the end of the session to go through any of your individual questions. And then after that, we'll talk about next steps. So this, like I said, this is week 4 of a 4-week series, and we are talking about self-care tips for pain with sex. The goals for today: I'm hoping that you can walk away understanding the causes and the different types of pelvic pain or reasons why you'd have pain with sex, and then learn some simple tips to treat it. So first things first, painful sex, what is it? So just the way it sounds, painful sex or dyspareunia, it's persistent genital or pelvic pain before, during, or after penetration. Now, this can be involve any insertion into the vagina or the rectum. I should say vagina or anterior opening or rectum. This could be with a tampon, with penis, with fingers, with a toy, or during a gynecological exam. Now, symptoms consistent with dyspareunia could be pain with initial penetration that may or may not ease over time. It could be deep pelvic pain that can refer to the abdomen, the hips, or the lower back, or it could be post-orgasmic pain. I should also say that with pain with sex, it can be either something that we call primary or secondary. It could be something that you've always experienced since initial use of a tampon, or getting started having a gynecological exams, or since initiating sexual activity, or it could be something that we refer to as secondary, where you were fine with use of tampons or going for your gynecological exams, or fine with your experience with sex, and then all of a sudden something shifted and now this is your experience that you're having pain with it. So what are the causes? I've broken down the causes into 3 big buckets here. First, it can be the result of insufficient lubrication or decreased libido, and that's something that most postpartum folks have the experience of. It could be the result of scar tissue adhesions or restrictions from C-sections, episiotomies, perineal tears, and or tailbone fractures. The third reason is could be involuntary spasms of the pelvic floor muscles. So we'll dive right into what can you do to address these. We're talking about the causes as these 3 buckets. The first thing in terms of managing issues with decreased lubrication or low libido, one of the reasons that you could be experiencing this, if this is your experience, is that you could have, or you may need topical estrogen. The reason why is postpartum estrogen levels, we talked about this quite a bit in the past classes, but estrogen levels do drop, they plummet after you birth the baby. Now, it directly affects the vaginal tissue, the vulvar tissue, and what can happen is that the tissue can tear very easily during sex. The tissue becomes atrophic, is what we call it, so it thins out quite easily. So that could be a reason. So being able to connect with your midwife or your OBGYN about having topical estrogen or prescribing topical estrogen to you can be really helpful. The second reason, personal lubricants and the second tip that you can employ to address the decreased lubrication is personal lubricants or vaginal moisturizers. Now, there are different types. Well, and I want to be able to distinguish the two first. Personal lubricants are typically used during sex. Vaginal moisturizers are typically used quite frequently through the course of a day or through the week, and not necessarily involving any sexual activity. Now, you do have some things that you can use as both, like coconut oil, right over here, for example. There are different types of personal lubricants. There can be water-based ones. A couple of examples here are this particular brand is called Slippery Stuff, and there's another one that we really like is, I say we as in pelvic floor therapists like, it's called Good Clean Love. It could be oil-based as well, like petroleum jelly or mineral oil, silicone-based types of personal lubricants like Uber Lube over here, and natural oils like coconut oil or olive oil. Now, it's important to understand, I always encourage my patients to experiment with what lubricant feels right to them. One thing to keep in mind as you choose the personal lubricant that feels right for you is that if you're using a condom as well as part of your birth control, oil-based lubricants can degrade the condom, so you may want to avoid using things like coconut oil or olive oil if you're using a condom. Now, again, in managing issues of decreased lubrication, the third thing, options for birth control. Now, working with your midwife or your OBGYN is really important because you want to understand what works for your body. Birth control that's non-hormonal, like a copper IUD, or a hormonal birth control, like oral contraception. Now, the reason why that's important, their evidence is very clear that long-term use of oral birth control can have a significant negative impact into the pelvic floor, the vulvar tissue, the vaginal tissue as well, and is associated with pelvic pain. So it's important to understand what, if that's been your experience, not everyone has that experience, but if that's been your experience and you are currently on oral birth control and you are experiencing pain with sex, that's something worth discussing with your healthcare provider again. Now, again, going back to the second reason I talked about, the reason why you might have pain with sex, scar tissue accumulation. So that could be scar tissue from a C-section. It could be scar tissue that's accumulated from a perineal tear or an episiotomy. Now, one thing I should mention, I added this image because it's helpful in understanding what you have to do or how much tissue you have to get through when you're looking to be able to manage any sort of adhesion or trigger point. Actually, let me not use the term trigger point. Let me use the word adhesion or scar tissue accumulation or restriction. So if this, for example, is this red spot right here is an adhesion. And this is at the result of a C-section. This is a C-section scar. I want you to be able to appreciate how much, this red spot again is the adhesion where my arrow is. I want you to be able to appreciate how much tissue, the muscle, the connective tissue you need to be able to get through to get into this spot to be able to manipulate it, reduce it, get some blood flow into it. So the different techniques that you want to be able to utilize in terms of managing scar tissue adhesions are manual desensitization. It could be, again, let me just refer to the C-section scar over here. It might be using a soft cloth over the scar to start to move it. Again, getting some blood flow, getting those nerve endings waking up. It could be over your clothes initially. Different other techniques would be skin rolling, like this example over here, or this picture is depicting that. It could be cross friction massage, where you press into the tissue and then you move it from side to side, up and down. It could be working into the scar by performing some mini circles. So you find you're on your scar, apply pressure, and you're moving in a circular pattern over the scar. The same principle applies when you're addressing perineal scars or episiotomies, where you're applying gentle pressure and you could be moving the tissue around or holding pressure in place as kind of more blood flow comes into the area, and the scar and the tissue just starts to soften up and the pain starts to dissipate as well. Now, in terms of involuntary muscle spasms, I listed that as the third reason why you could be experiencing pain with sex. I'm going to talk very globally initially. So on this, oh, and I did forget one thing. Oh yeah, with scar tissue manipulation, one really important thing, you do, forgive me for that quick aside, but I want to make sure that you're very aware. If you don't want to start doing any scar tissue manipulation unless you're at least 6 weeks postpartum, okay? And that applies to C-section scar or scar or tear that you've experienced from an episiotomy or you had a perineal tear. So you can perform something like this for 10 to 15 minutes, once to twice a day. But again, do wait at least 6 weeks before you start doing any direct manipulation of the tissue. All right, back to involuntary muscle spasms. So first, global stretches that you can do just to open up your hips, open up those pelvic floor muscles. These are different variations of really the same thing. This could be, you lying on your back, feet up against the wall, legs turned out, just thinking about, you always want to incorporate breath, quite frankly, breath work into all of this, allowing your pelvic floor muscles to relax and even stretch a little bit. Child's pose is great. This figure 4 stretch is great. Also imagine your legs supported on a piece of furniture or a foot up against the wall, so you don't have to work so hard with your arms. That can also be really helpful to open up the hips, open up the pelvic floor muscles. If you feel like more of a direct approach works for you, then using a tool like a trigger, like a ball or softball, tennis ball, to work into the tissue around your glutes, the sides of your hips can be really helpful as well. Now, you can hold these stretches. I've indicated 90 to 120 seconds for a deep myofascial stretch. And that, this could, oftentimes I'll give folks times or like the 90 to 120 seconds, or I can say, hold it for 10 to 15 breaths. So they're really thinking about softening into the stretch. You can do it that way, or you can move with this. You could do either stretching techniques or mobilization techniques where you're opening up your hips and gently moving in and out of that stretch position. That's also quite effective as well. All right. So down to the nitty-gritty, we talked about globally how you can work to open up, release tension very specifically into your pelvic floor muscles. But now even more specific than that, actually working using different tools can be really helpful to address those involuntary muscle spasms. The first tool that I'm going to talk about here are vaginal dilators. And in a moment, when I close out and share my screen, I'll show you with my pelvic floor model how you would do that. Vaginal dilators can be used primarily if you're experiencing pain with initial penetration. And these are the vaginal dilators over here. There are different brands of them, excuse me, and they can start with a fairly smaller circumference to a larger circumference. For when you're experiencing pain with deeper penetration, a pelvic wand like this one can be really effective. Now, the third thing here is a particular tool called an O-nut. This is actually not necessarily meant this is actually meant for a partner or to be used on a toy, a sex toy. That actually is really helpful to just minimize the depth of penetration so that you have control. Again, if this is your experience, you have better control over how much penetration you're actually experiencing. So that's also a really helpful tool that's only come out within the past, in most recent years, I think like 4 or 5 years or something like that. Don't quote me on that though. Okay. So I'm going to unshare my screen here for a moment. And let me talk, I want you to be able to see what different tools can look like. Again, the dilators and a wand. So this is a particular brand of a dilator, and it comes in this sort of Russian doll sort of setup where it can be relatively a thinner circumference here. It's a little bit wider, and one more to a little bit wider over there. So those are the 3 options, okay? And I like this particular tool because it does have a handle that you can use with it. Now, I'm going to demonstrate how you would use this with my trusted pelvic floor model over here. Before I do that, some important things to note. I have some folks that get really freaked out pretty quickly that they're supposed to insert the entire thing into their pelvic floor, and you are not. Now, the dilators, again, are supposed to be used or are really helpful if you're experiencing pain with initial penetration. And the entire tool does not have to go in, vaginally, quite frankly, especially when you're looking at a tool like this, like, really? But if you know that your goal is to be able to have, not have pain with penetration, and you know the size of your partner resembles this, you know that would be the progression that you're working towards. So you can start with a size a little bit smaller or much smaller than like this, so that you can work steadily towards your goal. Okay, so when you are getting started using a dilator, first thing that you want to set up is be in a space that you find safe, comfortable, relaxing. As a gentle reminder, for a lot of, well, maybe not as a gentle reminder, but I should just say in my experience with the majority of patients that I've worked with that have experienced pain with sex, this is something that has been the experience for most of the time, several months to several years, quite frankly. So even thinking about anything coming anywhere near their vagina or anterior opening can be really daunting and anxiety producing. So the nervous system gets really sensitized to, I'm gonna do some self-care, and what does that mean? And that already has your muscles, would have their muscles start to tighten up in response. So again, first thing, set up an environment that feels safe, comforting to you. And if you are starting off, ideally I prefer folks starting off on their backs with, so starting on your back with, in a semi-reclined position can be really helpful. Knees coming apart and supported on pillows. So if this is me and my pelvic floor, and again, I just gentle reminder, if this is the first time you're joining this course, this class series, your pelvic floor muscles are like muscles, like any other part of your body, and they should be treated as such. So the involuntary muscle spasms that I've talked about are this red stuff, again, representing muscles. And if there are trigger points in them, then that could be the cause of pain with sex. So going back to using the wand, if you are in this position, I'm going to take away this more superficial layer for ease of demonstration. You're inserting the wand vaginally here. Again, it doesn't have to be too far in. Insert it, and you're applying, you can start off by just keeping it there, quite frankly, and holding it for, you want to have some deep belly breaths going. Could be between 10 to 15 deep belly breath. And again, just allowing your body to relax, having these muscles soften, and just see how your body responds to that. If after 10, 15 breaths, this is feeling like nothing, you can start to apply pressure downward. This can be really helpful, again, if you have a perineal tear that would occur right about here, or an episiotomy. So you can apply some gentle pressure downward. And again, breathing and softening. The handle is helpful because you don't have to reach too far. After a few breaths, you can edge towards one side. Again, 10, 15 breaths, deep belly breaths. And same thing in the opposite direction, okay? So working in the bottom aspect of your pelvic floor. Okay, and like I said, you want to be able to steadily progress from whatever size feels most appropriate to you to whatever size you want to be able to get to. I didn't mention this, but be sure to use some generous personal lubricant with this, and whatever lubricant works for you as well. All right, now using the pelvic wand. So I've put an X marks the spot here in my pelvic floor, on one of the pelvic floor muscles right over there. Okay, so let's say that the experience for someone is pain with deeper penetration, and particularly because there's a trigger point embedded, I'll make it very simple in this particular area. So using a tool like this can be really helpful to access that particular spot. This wand has, either end of this wand can be used, quite frankly. So if I inserted this, again, vaginally here, and you can see how that can access that X marks the spot. Think of the same position. You could be lying on your back. If you feel more comfortable lying on your side, that's absolutely fine. If you're lying on your side, you may want your knees supported on a couple of pillows, see what feels right to you. And again, when you find that spot that feels tight or tender, again, it's not necessarily going to be the most pleasant experience because you are at a trigger point. The same way if you had a trigger point in your neck and someone came over and pressed it, it's like a hurt so good. Because it is your pelvic floor, most people don't have that awareness of a hurt so good unless you've been doing this for a while. But when you do access a spot that feels tight or tender, that is likely a trigger point or a myofascial restriction. Apply some gentle pressure. On a scale of 0 to 10, where 10 is excruciating pain, you may be eliciting somewhere around a 3 or a 4 out of 10. Use your breath, soften into that. Don't force your tissues to do anything that they're not ready to do, because everything will just spasm in response to that. But hold the pressure there. Again, maybe about 10, 15 breaths, see if that softens a little bit. And then find other spots on either side of your pelvic floor on the bottom, so you can get a little bit more specific. And when I say the bottom, so in this direction, so that you may be able to tap into some tightness that might be associated with your perineal tear or the scar tissue from your episiotomy. Okay. So I think I covered the main things with pain with sex. I would say before we go into some Q&A, and feel free again, like I said, just go ahead and type into the chat with any questions. The biggest thing that I would say with pain with sex, and bear in mind, and I want to acknowledge that I'm talking about sex in a very mechanical way. One thing that I want you to be very aware of, and I do want to acknowledge, is that for most of my folks who have experienced pain with sex, again, it's a matter of months or years that they've had this experience. This absolutely changes your quality of life. The folks that I've worked with, it changes how they see themselves, their bodies. It absolutely affects the relationships that they have with their partners. So it's important to be able to acknowledge the emotional, the psychological impact this has, along with the physical and structural impact that it's had on their bodies and on their lives. So be sure, if this has been in your experience, it's important for you to know that there are providers like myself that are here to help. Like I said, I'm part of a team at Agile Physical Therapy of women's health providers and pelvic health providers that help with this. So reach out, talk to your OB, talk to your midwife about it. These are, I've mentioned simple things that you can start looking at, but if this is something that you've been experiencing for a long time and you feel like you've been suffering in silence about it, know that this is incredibly common, especially incredibly common particularly common postpartum, but it is absolutely treatable. Okay. All right. So if you have any questions, please feel free to type that into the chat. And I'll stop. If you do have any follow-up questions from today, feel free to reach out. All right. So thank you all so much for joining me. It looks like, oh, great. All right. It looks like everyone is good. Thank you so much for joining me. Next steps, reach out to a pelvic floor physical therapist. If any of the issues that I've talked about over the 4 weeks have been your experience and you've tried some of these tips and something is not quite working for you, we are here to help you. Okay. All right. Good night, everyone. Thank you so much for joining me. Bye.